39-year-old woman comes to the office because of breast pain.
Both my breasts hurt.
She had an uncomplicated vaginal delivery a week ago and is now breastfeeding her baby. And the pain persists in both her breasts.
So we have seen the case visually, now we will read it. 39-year-old woman, gravida 1 pair 1, comes to the office due to breast pain. She had an uncomplicated vaginal delivery a week ago and is breastfeeding her infant. 4 days ago, the patient began to have bilateral nipple soreness with breastfeeding. However, for the past few days, the pain has worsened, present between feeds, and has prevented breastfeeding. She also developed bloody nipple discharge. The patient's pregnancy was complicated by gestational diabetes mellitus, but otherwise she has no chronic medical conditions. Temperature is 37.5, bilateral nipples and areola have open, bloody linear abrasions. The breasts are diffusely engorged and mildly tender to palpation, but there are no palpable masses or lymphadenopathy. The remainder of the examination is unremarkable. So the following is the most likely underlying cause of this patient's presentation. And he gave us 5 options. Bacterial overgrowth of stagnant milk in blocked ducts, Candida infection spread from infant mucosa, inflammation from underlying breast cancer, papillary tumor involving the breast duct, or infant positioning and latch-on technique. Okay guys, this sounds fun. Okay, let me talk about this for a little second. So let's eliminate answer choices. So the way you answer questions in step 1 or step 2 or whatever, the main skill, the most important skill you have to learn, I'm not saying, oh, it's good to learn. No, you have to learn this skill in order to score high in the exams, which is eliminating answer choices. And why is that? Like, why are these TAP exams designed the way they are? And the reason is, as a physician, as a doctor, what you are going to do throughout your career is basically eliminating diseases, eliminating illnesses. So, for example, if somebody came with chest pain, what you're going to do is not diagnose him from the top of your head. What you're going to do is basically have a set of differential diagnoses, about 7 or 8, and then start eliminating the most important ones, the most dangerous and the most common ones. This is how you make a diagnosis. So eliminating answer choices is the same exact skill that you will need as a physician. So it's very important to put this in the back of your mind, okay? So let's eliminate answer choices. I don't want to come up with anything from my head, okay? I am gonna eliminate answer choices. The first choice is bacterial overgrowth of stagnant milk in blocked ducts. Bacteria. We're talking infection here. Bacterial overgrowth of stagnant milk in blocked ducts. Okay. If a girl has her breast full of bacteria, what do you expect? A fever. An infection equals fever, right? There is no fever here. In fact, he says 37. The temperature is 37.5. Okay? Okay, number B, Candida infection. We know Candida. If the test maker wanted us to pick Candida, he would say immunodeficiency, or he would say, white flakes on that breast, for example. Okay? So this is very important. So B and A are out. There is no reason why we could pick that, okay? And also, Candida infection presents with a shooting pain, very, very severe shooting pain, and basically unilateral. You cannot have, well, you can have bilateral Candida breast infection, but like most commonly is only unilateral, okay? Inflammation from underlying breast cancer. In other words, inflammatory breast carcinoma. This is also out of the way because we don't have the buzzwords like peau d'orange, and we don't have the breast like engorged, inflamed, and erythematous. There is no other things. We just have linear abrasions. That's it. Number D is papillary tumor involving the breast ducts. This will not present with pain at all. It's a small tumor, very, very small tumor that, little projection from inside the ducts. Basically, when the milk passes by, it kind of removes the top of the papillary tumor, so you have a little bit of bleeding. So basically, papillary tumor of the breast ducts only presents with bloody discharge, right? So that's it. Number E, poor infant positioning and latch-on technique. The woman is basically feeding her infant, and the little guy doesn't know how to breastfeed properly, and the woman doesn't understand how to breastfeed her kid. So basically, he tries so hard and pick her nipples, which causes abrasions, as you guys see here, and then abrasions will cause pain eventually and soreness. This is perfect. Number E is perfect. Okay, and this is how we answer a USMLE step 2 question or step 1 questions, eliminating answer choices. Okay guys, see you. If you like this content, please comment and subscribe and like, okay? And share this with your friends and tell me if you want more content like this so I can keep doing more. Thank you so much. Bye-bye.